Rotator cuff injuries are really complicated as well as very difficult for the rehabilitation, and analysis of these injuries are also very crucial, and that is the reason that in today's video we are going to discuss a case of rotator cuff injury patient. Now here the patient who is having rotator cuff injury presents with physiotherapist. Physiotherapist is analyzing and finds out that internal rotation is passively restricted over here and external rotation is completely normal, strong enough when the patient is performing actively, and we need to find out from the given option that what should be the appropriate treatment for this situation of the patient. Option number A given to us is that stretching of internal rotators. Option number B given to us is strengthening of internal rotators. Option number C given to us is stretching of external rotators, and option number D given to us is stretching of anterior capsule. Now before going to the answer, let's understand the situation over here. The situation is something like that patient is having rotator cuff injury, first thing. Second thing, that internal rotation is restricted, but how it is restricted? It is restricted passively. And third point is active external rotation is complete and strong enough. So this much information is given in the question and we need to find out what treatment can be appropriate. Let's see option number A, which says that stretching of internal rotators. Now already know that internal rotation is passively restricted. Even if you are stretching the internal rotators, you have to perform external rotation for that. So it is going to actually improve your external rotation movement, but here it is already mentioned external rotation is actively appropriate and normal. Then why should we give internal rotator stretch for this particular purpose, for improving internal rotation? Doesn't make any sense at all. So that is why this option not correct at all. I am just going to put cross at it. Second option, which says that strengthening of internal rotators. Now my dear friends, I know many of you must have thought that this option will be correct, but we need to understand over here that passive restriction of internal rotation is there. It is not active restriction. We are not talking about that internal rotation is not happening because muscle strength is not there, right? So passive restriction means because some tissue is tight, some muscles are tight which are restricting the motion to happen in the internal rotation. It is not because of muscle strength. That is why the strengthening of internal rotators are again not going to help that much. So that is why I am not going to say that this option is correct. Option number C, which say that stretching of external rotators. Now I know that when I explained about the stretching of internal rotators, you got this idea that yes, if I want to improve internal rotation, I have to stretch the external rotators, which has to be done how? That you have to perform internal rotation to stretch the external rotators, right? So this is how we can actually improve the range in the internal rotation. So this option really looks promising to me. But before saying option D, we are not confirming this as the right option. Option D, which says that anterior capsular stretch. Most of the time anterior capsular stretch we do to improve, yes, external rotation and not internal rotation. My dear friends, that is why option C over here is the correct answer. If you thought about this answer, then really you have a good knowledge about rotator cuff injury, and let's say you just assume other answer, it's alright. You can still brush up your anatomy as well as the assessment skills by watching few videos over my channel, and also you can watch the other case scenarios from the Physioquest playlist on my channel to learn more about such situations. So thank you so much for watching this video. See you all next week with new question and new explanation.